Hello everyone, this is Little Monster speaking, and today we are going to talk about enteric fever. First, let's ask ourselves, what is enteric fever? Enteric fever is a severe systemic illness characterized by fever and abdominal pain caused by the bacterium Salmonella enterica, serotypes, typhi or paratyphi, that is transmitted through contaminated food and water. How does it happen? It happens after ingestion, where bacteria invade the intestinal mucosa and can spread through the lymphatic system to the liver, spleen, and bloodstream. Now let's talk about the clinical presentation and symptoms that vary from mild illness with low-grade fever and malaise to severe disease. Symptoms are often nonspecific, therefore misdiagnosis may occur. The first main symptom is protracted fever, greater than or equal to 38 degrees Celsius for more than 3 days. They also suffer from headache, loss of appetite, nausea, encephalopathy in severe cases, and diarrhea, which is seen more frequently in children and people with HIV. So we first start with laboratory tests. We have blood culture that should be taken in all possible cases with fever requiring hospitalization, ideally before starting antibiotic treatment. There is also bone marrow test that is the most sensitive diagnostic method but rarely used. We also have stool cultures that are limited of diagnostic use, and finally we have Vidal serology that is still widely used in low and middle income countries, but it is not reliable to diagnose acute illness and in returning travelers. Also, it is not practical in many low resource settings.
Treatment. Antibiotic treatment should be started promptly to reduce the risk of complications, such as intestinal perforation and chronic carriage. Mild cases can be treated orally, while severe cases can be treated with intravenous treatment. Recently, outbreaks of enteric fever caused by extensively antibiotic-resistant Salmonella typhi have been reported. There is a relationship between treatment and the risk of fluoroquinolone. Low resistance in adults and children take ciprofloxacin. High resistance in adults and children, it's divided into mild cases. Take azithromycin, while severe cases take ceftriaxone. Prevention. There are some things we can do to avoid getting infected. For example, 1. Access to safe water and adequate sanitation. 2. Appropriate hygiene among food handlers and typhoid vaccination. 3. Single-dose typhoid conjugated vaccines can be used for younger children, 6 years and above. Finally, let's together spread awareness and make a difference. Thank you for listening.